Welcome to the Healthcare Nation podcast. I'm your host, Rick Janata, and happy to be with you for another episode. And here at Healthcare Nation, we're committed to bringing you the thought leaders in the field, in the healthcare field, to discuss what's new and noteworthy and what's on their mind and what they're up to in the health sector. But first, a quick disclosure. The opinions expressed by the hosts and guests are for informational purposes only and not associated with any companies or academic institutions. And don't forget to please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And with any questions or if you want to contact us, just go to healthcarenationpodcast.com. So with that, Joe, our producer, Joe, how are you doing?
I'm doing good. How are you doing?
I'm doing well. Excited to get started. Another episode today and really what we're going to be doing for the next, I guess, few episodes.
Yeah, I know we just wrapped up the big challenges kind of chapter or series of episodes. What's next? What's the big next chapter? What are the next episodes about?
Yeah, great question. I think, when we think about the big challenge, that was really setting the stage to delve deeper into areas that I think will continue to represent, obviously, some of the biggest issues in healthcare. And what we need to do is talk to the thought leaders to start unpacking and discovering potential solutions and remedies to those issues. And also optimistically, I think, look at the upside of the challenges as we kind of get into a few areas of focus.
And who are we talking with today?
Today, we have an absolutely fantastic guest, Dr. Paul Coyne from the Hospital for Special Surgery in New York, a venerable institution. Obviously, folks who know the world of orthopedics or spine surgery would be familiar with HSS. But Paul is an author, an inventor, an entrepreneur. He's an incredible public speaker. He's got a tremendous personal story, which we're going to talk about. And I see him as an expert where there's the interplay of clinical practice, his background in finance and Wall Street, technology. He's truly a recognized healthcare leader. He's been seen as a under 40 by Becker's and Business Insider. Currently, he serves in the role of Vice President, Chief Nursing Informatics Officer for Hospital for Special Surgery. He has administrative oversight, obviously, for the nursing side of things, as well as advanced practice, but also deep analytics, clinical informatics, all of that. But the one thing I did want to share, Joe, is that he's an inventor, a designer. He got the technology award from Fast Company for design and innovation, and also presented at South by Southwest, where he also got an innovation award for artificial intelligence and machine learning. In addition to all this, he's on the board of visitors at Columbia School of Nursing, so has a tremendous background in all things healthcare with a deep expertise, I think, in technology and from the framework of nursing. So it's going to be an exciting show. Paul, great to see you, my friend, and catch up. What are you up to, my friend? What's new and exciting in your life and what you're doing at HSS?
We're on the cusp of building a 12-story building over the FDR Drive, a 94,000 square foot clinical building, which will adjoin to our main hospital facility. And the tower, it's called the Kellen Tower, and we're building it over the FDR Drive, which is a construction feat in and of itself before we even get to delivering world-class care there.
Well, I'll tell you, having grown up in the city, I can tell you that would be a technological feat. There's no doubt about that amongst everything else you're doing. So we want to come back to that in a second, but I just want to dial the clock back in time. We both have a little bit in common, starting out our career in the nursing world and continuing that. I think, obviously, I still have my license as you do as well. But with that said, listen, I want to go back, Paul, and really get back into your background. It's not only nursing, but the finance side, the technology side, just your career in healthcare, which has really been incredible. Tell me, why did you start there, and what led you there? I always like to throw this question out there.
That's a great question, and I think it's so important, and one we're not asking enough of people. Life moves on, and sometimes the reason why people did things, gets forgotten a little bit. So
exactly.
I had a stroke when I was 22, and had to learn how to talk and walk and regain all of my memories again. And while I was working there, while I was recovering from that, I was a derivatives trader at Goldman Sachs. And I could do the derivatives very well, but I had difficulty speaking. And, just really to prove to myself that I was still smart, and also to give purpose to what I went through and try to make a positive difference for others. Really felt that nursing was a calling, for me to do those things. And I went back to school and became a nurse. And that's really the reason why.
Well, that is so compelling. And, when I hear you say that, I can't help but think about passion and purpose, and putting those two things together, you really derive deep meaning from it. And I think that's been evident in your work. I don't know if you'd agree with that.
Yeah, no, I've tried my best, every day, a new chance to find the purpose and the passion again. Some days obviously harder than others, but I've really tried to, not forget where I came from and really at the forefront of my mind always. Some days I walk into the hospital, I feel like a patient, and I have to remind myself that I'm leading it. But I think that's kept me humble and allowed me to be a good leader.
Yeah, I also think it allows you to cross, the chasm of a transactional experience, and one, I think, which is more the compact of the clinician, the nurse and patient, and to have that perspective, that first person experience, and to be able to, it's more than empathy, really to walk the walk and talk the talk. It's just, again, incredibly compelling. And so thank you for sharing that. Boy,
Oh yeah, no, my pleasure.
Yeah,
and I don't, but I do it. I used to do it because I needed it. I needed to hear the validation that I was worthy, that I was capable. And in my own journey of life, I don't really need it so much anymore, but I still really like sharing it, just hoping that it makes me more relatable and encourages other people to share themselves too. I mean, the whole point of healthcare is to be honest and empathetic and authentic. And so I share now for those reasons. So, but yeah.
Well, thank you. And it creates that accessibility, I think, because so many of us, we might, submerge things, particularly as you're moving up in your career, not recognizing that it could be an inspirational, story for someone else who hasn't yet made the decision or is on the precipice of doing it. And I think that it's more than commendable to share it, because it could be inspirational to others. So thank you for that.
Yeah.
And again, look, let's pick up on a couple of things. Innovation, your initiative, clearly your background. You've done so much. You were named the top 25 innovator. I want to get into so many topics with you, but let me just start with this. With respect to where you are right now as Senior VP at Hospital for Special Surgery, tell me about some of the innovations that you've done there at HSS. Let's just start with that, and then we'll unpack it and kind of work backwards.
Sure. Yeah. I mean, I think some of what we're doing at HSS, I think the most innovative thing that we did, for those listening that perhaps aren't as familiar with HSS, we're the world's leading academic medical center dedicated to musculoskeletal health, and the #1 orthopedic hospital, according to U.S. News and World Report, in the United States. And we do orthopedic surgery primarily in our main campus. And during COVID, we needed to transform our organization into a COVID hospital. We made the choice to do that. Like all innovation, some innovations born out of want, but the best innovations sometimes are born out of necessity. And I think transforming our organization into a medical surgical COVID hospital to assist our peer organizations in the city of New York during COVID really sparked a lot of innovation very quickly at our organization to respond to that crisis and transform ourselves. And now, as we've resumed over the last year or two, our orthopedic surgery and our musculoskeletal health focus, we've kept those lessons through the pandemic. But the most innovative thing that I've been part of here in the 6 years that I've been here really is changing what our hospital does to completely to take care of patients with COVID, as opposed to orthopedic surgery, which we made a strategic decision to do, and launching vaccine centers and partnering with the city of New York to do that. And then through the lessons learned during those 2 years, over the last 2 years, really, as many organizations in the industry are doing, moving to a more virtual model for care, telehealth, the different ways that we're doing remote patient monitoring at home, all of these things that the industry is, taking part of, we are too.
And I think it's really helped the organization also expand its geographic footprint as well, right? Advancing what you do via telehealth into actual brick and mortar in other states.
Absolutely. Yeah, no, our expanding ASC footprint, our launch of HSS Florida, and also our, really global and national and global physical therapy footprint are all results of innovation that we've done now, sparked by the pandemic, but really expanded upon over the last couple of years.
Let me stay on that innovation theme and also crosswalk it to your background in nursing and your journey in nursing. Can you speak to the importance of nursing as a place, as a home for innovators, scientists, entrepreneurs? I think you are uniquely qualified to really speak to that.
Yeah, so I think certainly we're not doing it enough. Nurses are millions of people in the United States and innovating every day in ways that, people think of innovation like you have to start a company or you have to, get venture capital funding or all of these barriers to be like, oh, that could never be me. And, I've been fortunate enough to be part of, inventions that have helped invent and that have turned into companies, books on innovation that we've done. And, I'm not, my mother would disagree, but I'm not that special. I think all nurses are special and can do, sort of what I did if only the world, believed a little more that they could and that they believed a little more that they could. And I think we have this mentality that a nurse is meant to be at the bedside or a nurse is meant to do XYZ, a stereotypical view of a nurse, but the nurse, the role of the nurse is innovation. It was born out of innovation by Florence Nightingale. Through the years, more and more innovations have come from nursing. And I just don't think people view themselves that way. They innovate every day. I don't think they're giving themselves credit for all the innovative things that they do. And many of those things can be monetized and, more importantly, make healthcare better.
Yeah, I think about the clinical professions of anesthesia and also other disciplines like physical therapy or respiratory therapy. Many would argue they came out of the nursing field, right? So the long history there is just something I don't think folks recognize or understand the origin history of them. So getting back to you though, because I want to stay on this theme of kind of the innovation side and even your not only your research interests, but the companies you've worked with in the invention side, on the ideation and building it through. Tell us a little bit about that, Paul.
Sure. So after I finished sort of the stroke recovery aspect of my life, I was really just trying to convince myself that I was smart. And after the doctorate in nursing, I helped lead analytics at a major academic medical center in New York. And one of my colleagues in that program went to be a bedside nurse at the same hospital. And all the dashboards and all of the innovations that we were making in IT at that same hospital, we were putting them into, their intranet and ways where they could access them. And I said, well, isn't this great? All the stuff we made for you. And my friend, the bedside nurse at the same place said, I don't know anything about anything you made. And I realized if we weren't making the data for the people that were delivering the care, then really we need to ask ourselves, who are we making it for? And the two of us, set out. He was very frustrated that on the front line, everyone was telling him to do better and that outcomes weren't well and, all of these things, but not really. The way he described it was like giving a frontline clinician like standing in the locker room at halftime and the coach just saying, I know the way to do better, everyone. You need to score more points and then not give them a playbook to do it. And in many ways, that's what we're doing to frontline clinicians. So we really wanted to arm the frontline clinicians with data, with tools that would augment their care. And we set out on a great startup journey, like any other, startup journey with nothing, just the two of us and an idea to put this one device on the wall that would analyze both the physical and digital aspects of the room. And we're fortunate enough to meet a man who had background at NASA who made it. using thermal energy and Bluetooth low energy and edge AI to really analyze and aid the nurses with everything from falls prevention to optimal staffing allocation, pressure injury prevention, and data all in one device, put at the head of every patient bed that the organization wants to develop. The device is called AUGI now, for augmented intelligence, to ensure that it doesn't give the approach that we're artificially replacing humans, which I think is an important topic in healthcare, but really more augmenting them in aiding the great work that they do and mitigate and facilitating the healing process. And the company is called Inspirin, to inspire Ren, the Chinese term for altruism that dwells within us all. So Inspirin and Augie have been a great vehicle for me to not only invent and grow, but also to make a difference in the world. And, through that, have had the fortune of meeting just wonderful people around the United States who want to innovate too. And nurses, look to me now. I'd give more credit to the guy from NASA, but they look to me now as a source of, inspiration to say that could be me. And, I've written books on the topic of innovation and started nonprofits around nursing innovation. And I'm really passionate about frontline individuals believing that their contributions can go beyond the bedside.
Yeah. And I think when you're vexed with the problem at the bedside, so many of us have come up with solutions right there and then. Mm-hmm. It might be tape, right? Or, getting someone to come in and pull something together and taking some different contraptions to really remedy a situation. But to go beyond that, and as you did, start a company that's really solving for some of the biggest issues, I think it's tremendous. And in the world of technology and how fast it's going, obviously with AI and machine learning and ChatGPT, what's at our disposal now, it's almost exponential with respect to what we can leverage, I think, moving in the future. Along those lines, I want to ask you, with nursing as the focus, and think about the clinical experience, how do you see technology shaping the future of nursing and patient care delivery? I know that's a loaded question.
Yeah, no, I think my answer on that is that's the reason why I'm so passionate about nurses leading the development. Everybody's so afraid of an outcome that they don't want. And I think, and in this case, the outcome that is not good for anyone is patient care suffers. What makes healthcare really something special is one individual caring for another individual. And that cannot be replaced ever by a computer. We might be able to get close, but that part can't be replaced. And I think there's a fear that would go away. And in order to ensure that it doesn't go away, people who are really passionate about making sure that it doesn't go away need to lead. And that's why I'm so passionate about frontline clinical individuals who know the space, who know what makes it special, who want to preserve that, who know how difficult it is to have documentation burden and not be able to care for patients the way that you want. Lead and are heard. There's a way where AI and ChatGPT, all of these wonderful things that are coming out, can really augment that healing process. Or we can choose as a society to forget that healing process is the whole point of what we're trying to do and be no different than the robots. So I think that is the choice. It's our choice unless we make AI so powerful that it's not our choice anymore. But I think that's but I think for today, we should ensure that all the tools we make allow that process, the true process, to flourish. And that's why people who are passionate about it should lead it.
Yeah, I've got to get back to, kind of where folks start out on the journey, which is the educational process. And I think you're uniquely qualified to comment on this as well. You're on the board of visitors for Columbia School of Nursing. And with that context and your background, obviously your history and journey, as we spoke about, what's needed, what's lacking? I have a whole episode that I could dedicate to this. But now when we're looking at the shortage and the tremendous demand for nurses that are out there, what needs to be done and what changes do you think are necessary so that the individuals who are embarking on a career in nursing and starting it out on the educational side are getting what they need to really face the new challenges? And the kind of corollary to that is the system, the educational system for nursing education, providing them what they're going to need to be the content experts at the bedside with this technology and everything that's being thrown at us, on a day-to-day basis.
Yeah, I would say very bluntly, not at all is the education system setting them up for that. And I think the rapid course of the evolution of technological progress over the last, we'll say 100 years, but let's just even do 30, is unlike anything that we've ever experienced in human existence. It's extremely rapid, and systems and organizations need to evolve faster over the last 30 years as a result of the world changing faster than, let's say, they did in the 1500s on the medieval farms. That didn't change much from 1500 to 1650, right? But in the last 150 years, we've really changed. And so our education system needs to change, and particularly in nursing and all of the healthcare clinical disciplines. We're siloing the education and then wondering why there's a silo that exists in the healthcare organizations that everyone goes to work in. We have people trained in technology. We have people trained in business. We have people then trained in nursing or clinical disciplines, and doctors. And, as my grandmother used to say, never the two shall meet. That should start at the education process and continue through every organization. And that involves professors. Also, they don't need to even know more than one thing. It just involves numerous professors teaching a topic. I had the benefit of going to Providence College for my undergraduate, and they have a program there called Department of Western Civilization. And it's a 2-year program taught by 4 professors. And they would take, Greece, Rome, the whole thing. But day 1 would be a literature professor. Day 2 would be the theologian. Day 3 would be the philosopher. And then day 4 would be art and other. And then on day 5, we would have a capstone of how they all work together. That's a beautiful program because you comprehensively look at something and you're taught by experts in it. The tech people are learning tech from tech people. The nurses are learning nursing from nursing people. And I think we have to take a new learner who's 18 years old and wants to enter healthcare and give them the expertise so that they can be more multifaceted than we currently are. But that involves us looking internally to ourselves to realize that perhaps we're not as multifaceted as we wish to be. And that's really the barrier that I think that exists. It's a fluke, honestly, that I became what you'd said. I only wanted to be not sick. And I went to school, became a nurse. I got an MBA. I started tech companies, and somewhere along the way, when I have these conversations, it's kind of shocking to me. I guess I learned all 3, and I'm able to drive change and see the world that way. I just wanted to get my brain back, but I think there's more, even greater. Someone who says I have a full brain and I want to do all those 3 things so that I can truly help other people. I think those people deserve far more credit than me, but we as a whole healthcare industry need to recognize that we all have to do those.
Yeah. Unbelievably spot on with your points. I would say this, look, there's fragmentation in healthcare at the macro level. We know that. The pedagogical approach, right, with nursing education specific, equally as fragmented. Mm-hmm. And I think folks like you and I, clearly your personal story informed so much that allows you to have perhaps a level of empathy and insight, but also your finance background, that level of training that you've had. You're bilingual, right? And not only do you speak fluent clinical, but you speak fluent finance. And then underneath that, the common denominator is the deep empathy that's derived from your story. That's not something that's easily taught and usually comes with experience. And it really makes me think, how do we create and make sure that we're not, losing sight of the need for human connection and empathy in patient care. And you can't really teach that. So how do you inspire the nurses who are under your leadership at HSS and the folks who are even listening in? Tell us, Paul.
Yeah, sure. So there's 1,500 people that either directly or indirectly, I'm sort of responsible for in some way here. But 6,000 just by nature of having this role look to me for the answer that you just said. And, I think one at a time is the answer. I tried when I first got this position, to do live streams and these big speeches and, that there's a place for those. But then I realized that the most meaningful way to inspire another person to be empathetic is to show them that you're empathetic. And so once a day now, it's been the best thing that I do for me. And people think it's the best thing for them, but it's not for them. It's actually for me. I pick a random person every day and I spend 30 minutes with them. And, sometimes I get to have time for 2 or 3 of those conversations, but I really have no other agenda other than to know that person. And it just takes a half hour of my day. And it's always the best part of the whole day. And I'm up to, 200 or 300 out of the 1,500 direct reports. And then I know them. I see them in the hallway. I know their dog's name and I know their kids' names. And I try to remember them. And even if they see me struggle, they know that I cared enough to at least meet them. But then if I remember something from the conversation, it's not hard. Yeah. And it's not, people say, why did you do this for me? And it's not for them. It's for me. And if that's authentic and real and people mean it, then they feel it. And then hopefully they can do that. They do that for somebody else. And some of those people, you're not going to get everybody. Some of them will. And then I've helped the world a little more. And some of them will. And that's okay. I can't control anybody else, but I can control myself and be empathetic and try to be an example of that. But that's, one thing that I do. That's one thing that I do that I think is a simple thing that, tries that I think has made a difference.
Yeah. And creates a culture, which is, absolutely essential if you're trying to provide not only, excellent patient care at the bedside, but the kind of impact factor you want in the community. And again, that's fantastic. And what a commitment from a leadership perspective. Let me bring it down to the kind of practical and tactical level. I think there's a nursing shortage. I think there's a lot of nursing burnout. I think hospitals are increasingly stressed on the financial side, and as high reliability organizations, you could even say, pushing the brink, and many times on the safety side of things. You put it all together and look at reimbursement and CMS, and it comes up with the fact that we're probably going to need a new model of care that's going to have to emerge in the future. I see nursing as being, certainly in the hospital brick and mortar setting, being right in the middle and having this in the nurse executive's wheelhouse. What do you think the future is with respect to new models of care? What does it look like to you, Paul? Are you working on any? And maybe you could just blue sky and say, what's going to look like in 10 or 15 years when we don't have enough nursing and nurses, and when we're leveraging technology perhaps to scale our line of sight over a lot of different patients?
Yep. So I think I always try to go to the source of a problem. And I think there's a lot of, well, you mentioned 2 things. One was burnout and well-being, and another is the model of care. And I'm just going to separate them in my response. And I'll do burnout first, and then I'll talk about the model. Burnout, well, I guess I'll do the model first, and then I'll do the burnout. The model is a result of nursing being a cost to organizations. I've been helping a new commission for nursing reimbursement, a national effort, launch, and we just launched formally a couple days ago, and it's the Commission for Nursing Reimbursement, and it's aiming to make recommendations to CMS on how to improve this payment model. And I don't think people realize, this. Most clinical disciplines bill for services, and so they're revenue generating. And nursing in the 1930s switched to be a cost, and that is sort of a major reason of where this all begins. And I think in order to figure out how hospitals who want to deliver great care can be reimbursed for delivering great care in a way that rewards them for delivering great care needs to be looked at holistically. Until then, the hospital's administration are constrained by that model, and staff and the hospital administration are kind of at odds, but it's sort of the wrong fight. I think we need to look a little bit more macro at the model itself, the payment model, how we're reimbursed, how hospitals are, incentivized to deliver great care to solve that problem. And this Commission for Nursing Reimbursement, hopefully is one step in the right direction for that. That's the model. And then, until that changes, we have to be creative and as efficient as possible. I would argue it's not really until it changes. That's one step. The other step is to be as efficient, to use technology to facilitate that healing process that I was talking about earlier, and to come up with staffing models that allow a nurse to feel like they want to be a nurse the next day. And some of that starts obviously with financial, but then it really does come to technology uses on the floor, burden documentation of charting, new tools, virtual nursing. What kind of things can we do to make this a job that is like what you thought it would be when you decided that you wanted to be a nurse and nothing less? And I think all of that together, hopefully, I'm sorry, I don't have a perfect answer, but I think those are two good places to start. And then after that, that's what society can do for frontline clinicians. What clinicians need to do for themselves, though, is what we talked about at the beginning, and remember and find the moments and the little ways, whether they're the whole day or just a part of the day, that bring them joy and fulfillment, and look for it. But all of that's sort of getting kind of lumped in together now into something's not working well. But some responsibility falls on our society and our system. Some falls on the organizations that people work at, and some falls on the individual themselves. And we're not parsing all that out. We're just kind of throwing our hands up in the air and saying it's broken, we need to fix it. But I think in parsing those three things out, we will find the answer.
Yeah, I want to hear more on the commission's work when you wrap that up. Taking that thread to another level, what about advanced practice providers, nurse practitioners? Where do you see them and their role, as the system evolves and as we look at new models of care?
Yep.
We're both, nurse practitioners, so
yeah,
obviously I have vested interest in this. I always have. That's one of the reasons I went into nursing. So I'd love to hear your thoughts on that, Paul.
So I think, the nursing model blended with the medical model is made manifest in the role of the nurse practitioner. And I think people don't say that and really let that sink in for a second. There's a nursing model, there's a nursing training, there's a medical model of training. And the blending of them is the nurse practitioner. Right? And something that's blended has the opportunity to take the best of both. And I think that the role of a nurse practitioner in many ways can function autonomously in their blending, and in some cases teach nurses and stay in that lane and work with physicians to help. Anything that blends, in my opinion, typically a good thing for the world. And I think the role of the nurse practitioner has ways and more that can be done in all of those. They're not functionally autonomously. I don't think in 22 states now, last I checked, I forget the official number, hovering somewhere around 30 or a little more than half now, where a nurse practitioner can function autonomously, deliver primary care. That's great. And we're not really utilizing them optimally within certain settings. In many ways, sometimes we think of them as a less expensive version of the physician, which is not the appropriate framework. It's a unique role. There are many things that a physician can do that the nurse practitioner can't do. There are many things that the nurse practitioner is trained to do and blend that perhaps that would be beneficial as part of a team or autonomously. And I think the role of the nurse practitioner is one that really is very valuable to our country, particularly in underserved areas where there's not access to care. These individuals are willing and able to fill this gap. And this barrier still exists in many areas to not allow them to do it. And I think it's frankly silly. We talk a lot in our society now about wanting to ensure every person delivers care and that there's no health disparities. But yet we have these barriers that exist for people who are trained to fix them. So
Yeah,
I'm hoping over the next few years we see more of that changing so that the health disparities erase. And I think the nurse practitioners are very uniquely positioned to do that.
Yeah, I couldn't agree more. And I think if there's an issue with access to care, and when you look at disparities of social determinants, liberating advanced practice folks, nurse practitioners, physician assistants into the workforce in new and different ways. And certainly with respect to nurse practitioners, recognizing the independent licensure in a way that allows folks to flourish and to perhaps move into areas that are underserved because they know they'll have a level of reimbursement and remuneration that's different versus the current model, I think is a promising way to move forward. And I wish there was more states that were embracing this. We're seeing some positive movement. It just isn't fast enough. When I think about advanced practice, I want to get back to technology. I can't help but think about advanced technology because I do think that's going to be a key. You certainly have a passion and an affinity for that area. I wanted to ask you, what do you think are the most promising healthcare technologies? What will we be using to really, I think, take advantage of everything that we talked about from artificial intelligence on, but to solve the big issues of shortages or remote work? So what are those things that are in the black box that we don't quite know about? And in fact, what are the things that exist right now that maybe we don't have our hands on?
Yeah. So I think the electronic health record is kind of, designed as a tool to capture what happens in the environment so that we can make healthcare better. Turned into a tool where people are focused more on the electronic healthcare record than the environment that they're trying to make better. And that's a result of not having the technology over the last 25 years to get to the place where we are now, on the brink of, hopefully, where the electronic health record is a passive documentation system as opposed to an active, requiring the active input of a clinician. So I think there are people and businesses and things that are like everything else that are financially incentivized to keep it the way that it was. Too bad. That the electronic healthcare record, I will be extremely happy when that is a passive system where everything is stored and nobody has to touch it. And I think there's so many different ways that we can do that. Number one, natural language processing, audio, recognition, all of these things that we're doing to, ask my phone what music just played, who sings that song, we're not using in healthcare. And I think there's a way to listen to conversations, extract information out of it, document it. We're still, meeting with a patient and then going back and writing down everything that we did, or putting the screen between us in a primary care setting and typing up what we're saying as we're saying it. That needs to go away. And I think that would alleviate burnout. Number two is in diagnostics. I think we've already started to see some of this with radiology imaging, but also to use all of those different inputs into a always on sort of artificial monitoring, particularly in the inpatient setting. A lot of things and safety issues get lost through the transitions of care. Nurse comes in, next nurse the next day. In one day, you might see physical therapists and a doctor and a nurse and the PCA and your family member. And all of that is fragmented. And even though everybody writes down what they did, nobody really has the time, quite honestly, to read everything that everybody else did. There's two things there. One, you have to remember to write down everything you did. Two, you have to read what everybody else said they did, whether or not they remembered what everything they did. And so stuff just gets lost. And I think artificial intelligence can passively monitor a setting and alert and say things like, hey, in this setting, we heard the word decompensation like 5 times. This is usually not good. Hello, care team, pay more attention to this patient. I think that kind of thinking of a passive monitoring artificial system that alerts people of that gap, and then allows the individual to have more time to respond and care for the patient because they're not needed to document, I'm actually really excited. I hope that's where it all goes, and it would be great. So I think that's sort of where I hope, healthcare goes, particularly inpatient setting, but similar things can be created in the outpatient setting as well. But inpatient, no one should have anything worse happen to them in a hospital than God already intended for them. And I think we still have way too many adverse events, medical errors as a result of just this fragmentation that artificial intelligence, I think, could really help us with.
Yeah, I'm in complete agreement with you. I think the active, participation, checking the box, for lack of a better way to call it, is necessary, obviously, for the regulatory requirements, documentation, et cetera. But the passive acquisition, as you said, of cues, words in the healthcare ecosystem at the patient bedside to prompt folks to check things out, intervene, I think that's where we've got to go. I couldn't agree more, Paul. I think there's a tremendous opportunity with NLP to do that. And I'd love to see that, as you said earlier, augment the care environment so that we really can have an opportunity to pick up things much, much sooner than we do in all too many cases. So, yeah,
and
right.
The technology, just to double down, the technology is sort of right there. Audio monitoring, physical monitoring through computer vision, and Bluetooth Low Energy to monitor, to know what devices come around. I mean, all of this can be read right now and is being generated. It's just not finding its way sometimes into the electronic health record unless we type it in. So we have to find a way to sort of combine those 3 things so that AI can do what it does best, which is make sense of large, vast amounts of data and tell us what perhaps we're missing.
Right. Yeah, absolutely. Absolutely. Listen, just a couple more questions. This is a fascinating conversation, by the way. First, what advice do you have, let's just say for nurses, but I don't want to limit it to that, for other healthcare professionals who are interested in pursuing leadership roles, but I want to say leadership roles perhaps with an emphasis on innovation and technology, which I think it's like your career with a stamp.
Yeah. So I guess, leadership, I always break it down into knowledge, wisdom, and vision. And I think knowledge in what you're doing is extremely important. Wisdom, through your own life experiences, to take that part of you and apply it to the knowledge that you've learned. And then a vision to determine where you want to go. I think many leaders, if you break it down into those 3 things, you can very quickly see, well, this person has knowledge, but perhaps they don't have wisdom and vision. And then some people have a lot of wisdom, but they have no knowledge. Some people have vision, but no wisdom or knowledge. And, bad leadership happens when people aren't self-reflective enough to realize they need work in one of those areas. So I think in terms of leadership, knowledge, wisdom, and vision should be what anyone who wants to lead other people should do. And it needs to align with your own life. The vision you have for your own self needs to be the vision you communicate to the people you lead, because no one wants to follow somebody who's not authentic. In terms specific to technology and healthcare, I think admitting that you don't know, that you really don't know what you're talking about. I mean, even an expert technology, again, like I said before, is so fast, so rapidly evolving that, hubris or arrogance in terms of thinking that I'm, a technology expert. I've never even said that out loud. I won't ever say I'm an expert in any of those things, because as soon as you make that statement, and I appreciate you thinking of me that way, but as soon as I make that statement, there's a risk of my belief that I don't need to learn anymore. And I think, someone who's going to be a technology, wants to have a career in technology and healthcare has to remember has to remember all of that, but particularly with innovation in technology and healthcare, what is this? I usually tell a story about my grandmother for this answer sometimes too. I was raised in Cape Cod, Massachusetts, and she lived there. So we would go visit her for the summer. So I was raised there every summer. And every time we'd go down to visit her in the summer, she would take me to a new house that was being built in the village. And she'd say, she had a Boston accent. She'd say, they're working on that one on the corner. It used to be a nice little village there, and now it's going to stick out like a sore thumb. And I never understood why she was so mad. I thought, well, that house was built like 100 years ago. She just doesn't like new things. She's old, whatever people discount, your grandmother. But now I see people come in to innovate in healthcare who don't take the time to know the village, right? They don't know what makes the town special, like my grandma did. They don't know everything we just talked about how care at the center is really what we're here for. Some people just want to come with like a new house or a new tool or AI, and it sticks out. It doesn't bring the village together. It just stands out. So my grandma loved the new houses that tied the village together. She just didn't like the houses that did not belong. It's a Cape Cod town. There's a look, there's a feel to that environment. And sometimes these rich people would just come in and plop some mansion and it just didn't fit. And that's kind of what's happening in healthcare. And so I would really encourage anyone who wants to lead technology in healthcare, clinical or otherwise, to take the time wherever they're innovating to figure out what about that space is special and not ideal, and ensure that their innovation doesn't stick out, but enhances, that which makes the village wondrous, so that that which is not ideal is eliminated, and that which is ideal is strengthened. And that's the key in every piece of technological innovation and implementation to ensure that happens. And we're not anywhere close to doing as good of a job as we should. So my grandmother's in heaven probably saying, hey, healthcare's got to figure it out like she did for Cape Cod.
Yeah, so true. But she's watching you now, and I know she's very, very proud.
Thanks.
Listen, let me wrap it up with this last question. It's really about balance and well-being. You have such a demanding role. Your career, obviously, just tremendous, and I'm sure has come with a lot of sacrifice and pressure. At the same time, I know you have other passions and pursuits. You sing professionally in your free time. Obviously, your family is of great importance to you. How do you balance this all together? How do you do it, Paul? To convey that to me, to the audience. I think there's something to be learned there, my friend.
Yeah. So I think, number one is other people. Like I said, didn't do anything without other people. My family, my mom watches my son all during the week. I'm so fortunate. My wife is a nurse practitioner, but a great mom. No man is an island, right? And I think support, there's a time in my life when I was very sick and lost. So I never want to come across like, well, this is just how you do it. It's just, there are people who are struggling far more than I am and aren't at a place to balance. But I've been there. But I think once there's a place where you can work on balance, the way that I typically do it is to have one way that I exist in the world. For a while, I would kind of hop to all of those things. I would sing, and then I would be a dad, and then I would work, and then I would write a book, and then I started coming, very exhausting to, hop, in my opinion. And I think a lot of people, when they seek balance, they think of it like a seesaw. We're going to do work and then we're going to do life. I'm going to sing and then I'm going to be a chief nurse executive, and it's exhausting, quite frankly. But then, I don't know, somewhere along the way, I figured out that I would just be me, in all those spots, and that me would be someone who's just tries to make each place I go a little better than if, like the technology. I view myself, I try to go to a space and make it better. A little better than it would have been had I not been there. That's really my only motive now. And existing in that framework, or trying to, sometimes I mess up and I make it worse, but trying to live with the mentality of, well, I have this conversation with this person, I'll make it better for them. My son, how can I make his day better? My wife, I'm singing, how is it better for the audience, right? It's the same Paul throughout the world. And so it's not exhausting anymore. It's very fulfilling. It doesn't feel like I'm doing multiple things because I'm just being me. And I think healthcare, like we talked about, we need to get back to having healthcare be a place where people can do that, to have what they seek be in the workplace, so that they're not seeking something else in their life. That's how you find true balance. The other way is a seesaw balance that I personally have never found fulfilling, and I've been fortunate enough to arrive at a place where I'm more fulfilled, and I hope my goal in life now is just to help other people try to do that.
Earlier you mentioned authenticity, and I could tell you this, my friend, you are the model for an authentic person. I thank you so much for sharing your story, your insights, your perspective on technology and nursing. This has been a fascinating conversation, Paul. Really has been.
Thanks so much for having me.
Oh, it's great to have you on the Healthcare Nation podcast.